you know Medicare has policies for healthcare providers involved in the ordering or referring of services for beneficiaries? Whether you're the provider ordering or referring the service, or the provider receiving the order or referral, this video is for you. We'll review the enrollment and documentation requirements for the providers ordering or referring the service, and then we'll cover the claim requirements for the provider performing and billing for the service. After watching our video, you'll learn the key tips to prevent delays in the processing of your claims, documenting and billing Medicare orders and referrals. Let's start by reviewing the eligibility criteria. To be eligible to order or refer services, a provider must meet certain criteria. First, they must be enrolled in the Medicare program. When a provider enrolls, they must include on the enrollment application their National Provider Identifier, or NPI, their provider type, such as if they are a physician or non-physician practitioner, and their specialty. This allows us to capture their information in their enrollment file and verify that they meet the requirements to order or refer services. The provider must also be an eligible physician or non-physician practitioner to order or refer items or services which we show here. These practitioners include doctor of medicine or osteopathy, physician assistants, and clinical social workers, to name just a few. And to help you verify if a particular physician or non-physician practitioner is eligible, CMS has created the Ordering and Referring Data file at data.cms.gov. This website makes it easier to discover, access, and understand CMS data. The Ordering and Referring Data file has the NPI and legal name of the physicians and non-physician practitioners that meet the requirements to order or refer services. We've also included a link to this data file in the video description below. Verifying a provider's eligibility to order or refer services will assist you in preventing claim errors. Now that we've talked about a provider's eligibility to order or refer services, let's look at the requirements for documenting the orders or referrals. When we're performing a medical review of a claim, we'll review the entire medical record to see if we can locate the information that supports the services being billed. We must be able to distinguish three requirements. First, the service must be ordered or referred by the physician who is treating the beneficiary and will use the results in the treatment of the beneficiary. To verify this, we look at the order, who it is ordered by, and the progress notes or office notes to determine the connection between the ordered services and the diagnosis or symptoms of the patient. Second, the documentation must include a properly authenticated order or an authenticated medical record showing the provider's intent to order the service. Proper authentication means it has been signed and dated by the provider. If the medical record is properly authenticated, shows the intent to order and medical necessity, along with how that treating provider will use the result in treatment, then the medical record is sufficient and a separate order is not required. And third, the authenticated medical record must contain sufficient information supporting the ordered or referred services are reasonable and necessary. For more information on the documentation requirements for services, we've included links in the video description below to some great documentation checklists we've created on our website. So, we've reviewed the eligibility criteria and documentation requirements for the ordering or referring providers. Now, we'll look at the claim requirements when submitting the ordering or referring provider on the claim. For this, we'll include the paper claim form locations. Please keep in mind the electronic equivalents may vary depending on the software you use for your claim submissions. To assist in completing electronic forms for these requirements, we've also included in the video description a link to the CMS 1500 form data, element requirements that show the electronic equivalent for each paper claim item. On the claim, you must include the name, qualifier, and NPI of the ordering or referring provider. The name and qualifier are included in the item 17 of the paper claim form. For the name, you want to include the first and last name of the provider, but do not include their credentials, middle names or initial, or any other extraneous information. The qualifier you include will be determined by whether they are an ordering or referring provider. The available qualifiers include DN for referring provider, DK for ordering provider, or DQ for supervising provider. And the NPI should be included in item 17B of the paper claim form. Here's an important tip. Do not include the provider's Medicare ID, also known as the PTAN, in this section. It must be the NPI. We use the NPI to validate the provider's eligibility to order or refer the service. So, whether you are the provider ordering or referring the beneficiary for the service or the provider receiving the order or referral, there are three things you should keep in mind. First, check the provider's eligibility to order or refer by checking CMS's Ordering and Referring Data file. Second, make sure the documentation includes the order or intent to order and that it's properly authenticated. And third, submit the ordering or referring provider's name and NPI on the claim. Keeping these requirements in mind will help in providing valid, accurate documentation for the order or referral if it's requested. We hope you learned what you need for ordering or referring services for Medicare beneficiaries. You can find more information and resources in the video description below. Also, don't forget to subscribe to our YouTube channel to access more of our educational videos. Thanks for watching.